Alrighty, so you are here for your pre-op for liposuction and lipostructure. Let's say we're doing liposuction with a butt augmentation. In that case, you're going to come in, you're going to see Stacy for your pre-op visit. She's going to do the routine things that she does in all pre-op visits. One of those things is going to be take photos. And the reason I talk about butt augmentation at this time is the photos for a butt augmentation are a little different than any of the other photos we do, except for maybe thigh lifts. With a butt augmentation, Stacy's going to ask you to completely disrobe, and so be prepared for that. She's going to take some pictures of you. It'll be in a private room. Those pictures are only for your medical chart. They're not ones that anybody else see, but they're so we can see your whole structure of your buttocks. And if we see any dents or dimples or things like that we need to try and fill, we're going to be able to see those during surgery and be able to use those for a surgical procedure. So she's going to ask you to do that during surgery and take those photos so she can be able to help us achieve the best outcome for you possible. With liposuction, regular liposuction, you're usually given a pair of underwear to wear during the photography that we do, that Stacy does. And so you'll be asked to do that during that time, so you can get a bunch of different views of everything, so we can see things from different angles and different sides, so we can see all the areas we're liposuctioning and all the areas that may have differences from side to side, so we can get the best outcome. Next, she's going to give you prescriptions of medications. And so, as with all of our surgeries, we give 3 main medications: a pain medicine, narcotic, typically something like Norco, if that's something that works for you, something different if necessary. Keflex, which is an antibiotic that we give everybody after surgery. Again, unless you have an allergy to that, then we can use a different alternative medication in that case. And Zofran or ondansetron, which is an anti-nausea medicine. That anti-nausea medicine is on a PRN basis, as is your narcotic, which means it's an as-needed basis. It's not one you need to take on a schedule like the antibiotic that you're given. So if you're not nauseated, you don't need to take it. If you are, you can. We find that some, not very many, but some patients get nauseated after surgery. Especially that seems to be more common in women whose blood pressures run a little lower, and for 2 main reasons. One, your blood pressure is lower typically, so when you get a little dip in blood pressure, which almost all of us do after surgery, that's going to make your blood pressure drop in a range that's low enough that your brain's telling you, I don't feel good, I don't like this, I need higher blood pressure. And one way to help you get higher blood pressure is to drink fluid. So you want to drink at least 1 gallon, if not 1.5 gallons of fluid a day after your surgery. Is super, super important. And my recommendation is you drink something that has sugar and electrolytes in it. Water's okay, but juices, things with electrolytes and sugars are also great. And by the way, ginger ale is an antiemetic itself. It's a natural antiemetic, which means a natural anti-nausea medicine, and it's going to help you achieve a better feel and less nauseated feel and a more awake feel than some other things are, also because of the sugar in things like soda pops and juices. Those are going to help you feel a little more alert, a little more awake, and a little less nauseated, because remember, you will have not been drinking or eating from the night before surgery. And now you're going to have come in that morning, had surgery that day, and then sit there in our recovery room. So all day long, almost 24 hours, you're going to have gone without any food, without any sugars in your systems. The surgery itself, as you're recovering, your body's going to be wanting to utilize sugars out of your bloodstream to help heal the area that was just operated on, and it's going to be doing that right from the beginning, right after the surgery. And so it's going to lower your blood sugar, and that lower blood sugar will also contribute to the nauseation that you might have, or the nauseated feel that you might have. And so using a drink that has sugar in it can really help prevent that and really help you feel better overall. So lots of fluids, 1.5 gallons, something with sugar in it to help you feel better, as well as the anti-nausea medicine Stacy gives you. And then the other real important thing is, before you come to surgery, Samantha, our patient coordinator, is going to have sent you a packet, probably by email.
Yes, it comes via email, so make sure that you check your junk email. Sometimes people will call and say they haven't received it, but that's because it's in their junk email. You read through that thoroughly, and when you come in for your appointment that day, you're going to be signing those consents, so make sure that you've read through it thoroughly. So therefore I can answer any questions that you have about that consent as well. You also will be, make sure one other thing, you pick up your prescriptions right away after surgery. A couple days within the time frame that I send them in. That can be a problem for people if they wait right until the day of surgery. So make sure you pick up those prescriptions. Also, if we've requested you get an EKG, a mammogram, or any type of pre-labs before your procedure, we want to make sure that you have those done as well. It's imperative that you have those done before your surgery, so we request that you have them before you actually come in for your pre-op. So that way there's no delay in your surgery.
The other things about that packet that we were talking about too is that we're physicians, we're healthcare providers, so our job is to do a great surgery for you and help you have a great outcome and take care of you through this whole surgical process so you're safe. But the other big part of our job is to be guides, to be counselors, to help you make good decisions and to answer all of those questions. This is one way we do that, is to communicate through these videos that we're doing and through our consultations that we give you. That's a way we can help guide you and instruct you and inform you on the different decisions. But also it's important to read through those packets thoroughly so you understand all of the things associated with the surgery. All of your questions can be answered in those packets. And if you have more questions after reading those packets, that we can be there at the time of the pre-op to answer the rest of those questions for you, to make sure you're thoroughly informed and can make the best decisions for yourself, because after all, you are who this is about. There you go. That's your lipostructure and fat grafting liposuction pre-op.